Okay, I'm going to attempt to narrate this as best I can. So we're going to do a breathing assessment session. Please adhere to the disclaimer below. Take a few moments to read through that, as some of the information is probably quite integral to you, particularly around the questions around emotional and physical states and the fact that it should not be in place for advice from a trained medical professional. So we should be concerned with breathing because ultimately it's got primary functions that help move important fluids around the body, so particularly blood, and within blood we carry oxygen and other cells, or red blood cells and white blood cells, that we need for things like the healing process. So it's really important to us from a biochemical perspective and a biomechanical perspective as well. But I suppose for us, we're really concerned with the secondary functions of breathing, because what breathing does is allows us to self-regulate mental and emotional states through regulation of the nervous system, but it also helps us with functional movement as well. So for those of you who have things like issues with dysfunction in the upper limb, so shoulder to overhead movements, that can be due to muscle imbalances around the neck, shoulder girdle, abdominal, spine and pelvis. And in particular, dysfunctional breathing can lead to neck pain, back pain, pelvic pain and incontinence as well as poor stabilisation of the spine, because some of the breathing muscles are involved in core stabilisation also. So we might see a decrease in spinal support, which ultimately is important when we think about things like squats. So we're going to do some self-assessment now, and the first self-assessment is the high-low assessment. So what I'd suggest you do is take a few moments to pause the video, start in a seated position, and then follow the instructions that are currently on the screen. You're going to place one hand on the sternum and one hand on the upper abdomen and take 5 normal breaths, noting where you feel the movement and whether the movement is paradoxical or not. So take a few moments to pause the video here. Following the high-low assessment, we're going to do functional residual capacity testing. So this refers to the volume of air left in the lungs after a normal passive exhalation. You're going to need a timer for this test, and again, just pause the video here, take a few moments to complete the test, read through the instructions on the screen, and then complete the test as it is described. So take a few moments now to complete the TLC assessment. So this refers to, again, total volume of air in the lungs. Follow the instructions as they're prescribed on the slide. And this one is, again, completed by breathing in, breathing out, and then taking a deep breath and holding by plugging the nose, holding for as long as possible. Just make sure someone is around for you in this test. This is followed by a questionnaire, so again, just take a few moments to pause the slides, read through the questions, and you should be scoring yourself a 0, 1, 2 or 3. In terms of the high-low assessment, this is a standalone assessment and the results are listed on the slide here. So if you're upper chest dominant, it's typically dysfunctional. If your pattern is paradoxical, it is typically dysfunctional. And if you're abdomen dominant, you're more likely to demonstrate functional breathing. However, it should be noted this should include movement of the rib cage in a lateral direction. In addition to the abdomen moving forwards and backwards, the rib cage should be moving out to the side at the same time. Take a moment to pause here just so you can rank yourself in terms of results for the FRC and TLC. You're going to score yourself red, yellow or green. Again, take some time to score yourself the questionnaire. If you scored a 2 or a 3 of any of the questions, you're going to automatically score yourself a red. A score of 1 for any of the questions is yellow, and a score of 0 is a green. And then finally, this will allow you to interpret the results. If you are green overall, your breathing is suggested as optimal and it's likely you move very well. If it's a yellow, you're likely to demonstrate some deficits and should practice breath retraining. And finally, if you're a red, you should really address breathing dysfunction, which might be associated with some movement dysfunction as well.